good evening viewers. You're watching this special broadcast at 6 p.m. I'm Suesha Sawant, and every evening at this time we take the COVID questions sent in by you. Today we'll talk about black fungus or mucormycosis and why cases in India are on the rise, how it can be treated, and what are the do's and don'ts and early signs that you need to recognize. Joining us on the broadcast is a very special panel of guests. I'd like to introduce Dr. Shikha Gupta. She's an assistant professor, Eye Department, AIMS, joining us live from Delhi. Very good evening, doctors. And of course, the concern these days is black fungus or mucormycosis. Attention to that answer, for which I'd like to go to Dr. Gupta now. Dr. Gupta, firstly, to understand from you that those who are developing mucormycosis, what are the risk factors involved? Are particular age groups more at risk, being the youth or being the elderly age group? And also, are the family members equally at risk if somebody is developing the black fungus? Are the family members immediately to stay away from the patient?
So the question is good that unlike COVID infection, the mucormycosis is not contagious. The mucospores are already present in the air, and the most important criterion for developing mucormycosis in any patient is immunosuppression. As Dr. Ojha has already mentioned, that the immunity has to be low when the fungus invades because it's already there. So it's not that if somebody gets in the family, the others will also get it. It's just that immunosuppression, and mostly it develops after the patient has recovered from the active COVID infection, or even during COVID if the patient has a prolonged course and the patient is on high dose of steroids. So the two factors that are being postulated that why the mucormycosis is on the rise these days, unlike during the first wave of the COVID last year, it is because first thing is rampant use of steroids and tocilizumab also, which is an immunomodulator. It also works to decrease the immunity of a COVID patient. The other thing is the industrial oxygen could be a factor in this, that it is not sterilized oxygen that has been used in the hospital so far. So this is unsterile oxygen and it's going through the pipes. But there are certain, and there's a lot of panic in the population right now. I would like to stress here that there's no need to panic. It's not that every COVID patient will get it. It's only that if you are immunosuppressed, you just be careful that you keep noticing any changes that might take place over the few days, especially during the first 6 weeks of contracting the COVID infection. That is the most crucial time that you should be aware that, okay, if I'm immunosuppressed, I have taken large doses of steroids, or I'm a cancer patient, or I have had a transplant and I'm on immunosuppressive therapy, that, okay, I am immunosuppressed and I should be aware of all the symptoms and signs. It's already been mentioned by Dr. Ojha that there will be some paresthesias or hyperesthesia on the nasal region because it starts from the nose region. The spores will be inhaled through the nose first. So there can be local swelling. There could be bad smells. Unlike the anosmia that is seen in COVID infection where the patient is not able to smell, in mucormycosis it gives you foul smell, dirty smell that the patient might be having. Then there could be localized swelling or pain.
Right.
If it invades the sinuses. It could go through the dental region, to the palate. There could be pain. There could be irritation in the nose. The patient might feel that I want to tickle my nose more frequently. There could be some discharge also, some mucoid discharge or blackish discharge also if blood vessels have been eroded. So these are the things. So there are certain precautions that the patients can follow, and they would be safer than the usual population. So first thing is that you have to keep the nasal hygiene very well in place. You should be doing, even now the patients are also on inhalational steroids. So that also goes to the throat, and sometimes the patient may be using nasal steroids also. So these are all risk factors that it is suppressing the normal flora of our body. That is a very important risk factor for fungal invasion. So it's very important that after you are taking steroids, inhalational steroids also, you gargle thoroughly. There is no leftover steroids on the tongue coating, there is no coating. Also, it's important that you keep gargling. You can do betadine gargles also. There are betadine nasal sprays also available of 0.5 concentration that you can do nasal sprays. And you should be thoroughly cleaning everything. If you are on home oxygen therapy, you should be cleaning your tubing very, very thoroughly, that there should be no infection, no spores that may be there in the tubings, plus the water that we use to mix the oxygen with. That should be distilled water in the humidifier. That is also a risk factor that could, invade the already immunocompromised tissues of the patient. And of course, there is no need for the patients, the relatives or the family members to stay away from the patient. So you should be very aware, and if you suspect that you might be having some mucormycosis symptoms, you can have an endoscopy done by an ENT surgeon who could actually tell you that there is a lot of panic, there is more of panic, and you're not having this. But still, it's important to be aware, then not aware, being aware and getting the infection spread through the whole of the rhino or vital system.
Right. Dr. Gupta, if I can go to Dr. Parker next. Gentlemen, these have been very, very valuable inputs, and I'm really running short on time. In fact, I have to wrap the show very fast. Dr. Gupta, if I could quickly come to you in the end and an answer from you in brief on the do's and don'ts for mucormycosis that one needs to be very careful about.
So I would say that do not be in a panic mode, do not stress, because that also helps to decrease the immunity. It's a good factor for the fungus to grow in your body. So be happy, keep enhancing your immunity as you can, and keep your sugars under control. So HbA1c is a very good way which can tell you how your sugars have been the past 3 months. And you can also get your sugars tested in between. So if you are diabetic, be sure that your sugars are controlled, and if not, consult your endocrinologist at the earliest. The second thing is steroid should not be used for too long and should be started only after 5 days of contracting infection. Only if there has been some kind of inflammation, your breathing has deteriorated, or your CRP score is high in the blood test, or CT scan shows a high CT score. So these are the indicators of starting steroids. And of course, you have to keep gargling with betadine. There should be proper mouthwash. Keep your hygiene maintained, and beware of the symptoms. Keep checking of all these symptoms: some hypoesthesia, some redness, some irritation in the nose. So it will start from the nose when in the beginning, and consult your ENT specialist, consult your doctor. That is very important, that you should have a good relationship with your doctors. Keep checking with them whether you could be having at small symptoms, especially if you are immunocompromised. So, and the most important thing is have faith. It's not that you will be the one who will contract the infection. So be aware, but don't be in a panic mode. That's my take-home message.
Thank you so much, doctors, for educating our viewers on black fungus or mucormycosis. Very unfortunate that cases are on the rise. And as much as we can learn and follow and be careful is the mantra at this point. Thank you very much once again for speaking to Republic.